My name is Sochi. I'm a third-year medical student, and I spent January to May 2024 working with Refugee Health Alliance, or RHA, in Tijuana, Mexico.
Hi, my name's Leilani Gutierrez Palminos. I am a graduating now fifth-year student because I did the dual degree program through the Prime LA program, the MD MPH. I was able to spend 2 months in Tijuana with Refugee Health Alliance.
Refugee Health Alliance, or RHA, is a binational organization that is based out of Tijuana in Mexico and predominantly serve the migrant population there in Tijuana. So a lot of international patients coming from all over the world, and a lot of patients who are either asylum seekers trying to enter the US or deportees sent back from the US. The focus of my project with RHA was antibiotic stewardship.
I decided to do public health work through my MPH with Refugee Health Alliance, particularly because it's in Tijuana and all the border health issues that I really care about. I was born in Mexico and lived as an undocumented immigrant in the US for most of my youth until I was able to get my documents. So it is something that's very close and near and dear to my heart. Then I'm interested in going into OBGYN, and I wanted to work with Refugee Health Alliance, but specifically the partera or midwife branch, because I wanted to see how they did their health practices a little bit differently than how OBGYNs might do it in the hospital. And so they have a lot of ancestral and cultural practices, herbs, remedies, the way that they have empathy and compassion for their patients, very trauma informed, especially with all the immigrant, migrant, low income sort of people that they attend to. And so I knew that I really wanted to work with them.
There are several things that make RHA unique. Number one is the proximity to UCLA. So there is an opportunity for real longitudinal work if students want to go down for the weekends during first and second year, and then spend a longer time with Discovery, and then again in fourth year. There's that closeness. Advocacy is really at the base of what RHA does, and so there are many different examples. It's hard to pick one. I will say one thing in my recent experience that I remember is around language advocacy. RHA has now has permanent Haitian Creole interpreters that are staff interpreters there all the time. And that's a really great addition to the team because there are so many Haitian patients that we serve. And there was one particular family that had a son who, they were Haitian and didn't speak any Spanish. Their son had a lot of neurological disorders that needed long-term care and frequent visits with specialists in Mexico. And since they didn't speak any Spanish, we had one of the staff interpreters accompany them to their appointments so they could help interpret and make sure that the patient and his family was understanding what the providers were saying. And that, for me, is one of the examples of really strong advocacy for patients.
It's not just about the medicine that you see at Refugee Health Alliance, but medicine encompassing well-being in general, and all of these different services that we may take for granted in the US that truly are just should be basic fundamental rights for everybody. You truly feel like an appreciated human being when you're in their presence, and they try to make people feel that way no matter where they're from, and not just like a patient and a number or a disease, but holistically overall your well-being. So I thought that was a really special experience with RHA.
I would really like to thank the Global Health Program for supporting these types of experiences and supporting me to go and work with RHA in Tijuana. It's been a really incredible experience and opportunity, and I couldn't have done it without them.